Hey, and welcome to The Decibel. I'm Tamara. As more and more people get vaccinated and the rest of the country is looking towards opening up, Alberta's just gone in the opposite direction and introduced a bunch of strict new measures. Until recently, Alberta Premier Jason Kenney had been bragging about the lighter touch his government had taken toward the pandemic. But last Monday, he said that the situation inside Alberta's hospitals had left him with no choice.
This is about more than just COVID. This is about the entire healthcare system.
With over 560 cases per 100,000 people, Alberta now has the highest COVID-19 infection rate in North America. Hospitals are already feeling the pressure, ICU admissions are expected to grow over the next few weeks, and the worst case scenario is if cases keep going up, hospitals could be so overwhelmed that doctors would be forced to decide within a month who gets critical care and who doesn't.
Initially, it will be people who have an 80% chance of dying over the next year are excluded from ICU care. If things get worse, that will move down to 50%. So basically, if you've got a 50% chance of survival or worse, you're not getting into the ICU.
So how did we get here? James Keller is the Globe's Alberta bureau chief, and he's been watching this crisis unfold. That's today on The Decibel. Let's get into it. So Jason Kenney announced new restrictions to stop this spike in cases and to kind of avoid the worst case scenario in hospitals. What kind of changes did he introduce?
Alberta was really open. I mean, most businesses are open. Gyms were open in a limited capacity. Restaurants, indoor dining was closed, but patios were open. In Calgary, kind of along 17th Avenue, which is sort of the restaurant bar district. And, walking around there on a Saturday night, it felt very much pre-pandemic. Lots of crowds of young people in big groups, eating on patios. So last week, all that's closed. So they've shut down patios. They've closed a few more businesses, categories of businesses, and the schools are shut down.
It sounds like they're enforcing the rules with a bit more vigor too, right? Like I heard about some pretty high-profile arrests that have happened in the last little while.
Yeah, there have been some frustration in Alberta that, there were all these public health rules that were not going enforced. So kind of the big example and probably the pivot point for this was a couple of weeks ago, there was this protest rodeo near Bowden, which is just south of Red Deer. Fairly large crowd showed up for, what was billed as a rodeo, but also a protest of the public health measure. So very intentionally defying the current ban on outdoor events.
How about a lot of bucket horse?
After that, Premier Jason Kenney had some pretty tough words condemning that activity.
I was very disturbed. Actually, I was angered to see large numbers of people gathering this weekend at an event in Bowden in flagrant violation of the restrictions in place and of any common sense public health measures.
So last week, the Premier and his Justice Minister promised a more coordinated and tougher approach to the repeat offenders. And we saw that this weekend where, we had this protest at the Whistle Stop Cafe in Mirror, Alberta. The owner of that restaurant was arrested and there were tickets handed out to some of the attendees. But we have to remember, that's not the first time. Earlier this year, Pastor James Coates of the Grace Life Church near Edmonton, he spent more than a month in jail. And that was after months of having these very large packed services with no distancing, no masks. And at the time, that was the criticism, that this had been allowed to go on for so long before any kind of intervention. It finally happened, but it took months.
So the Alberta government is taking this seriously now, but it seems like these restrictions were introduced quite late in the game once the hospital situation was already really dire. So why do you think he waited so long to introduce the restrictions?
Well, that's been the approach through the whole pandemic. So the Alberta government has made it clear that we're not trying to get cases down to zero, right? The goal here is to try to figure out a balance where we're putting in the measures that we need, but not going overboard and trying to figure out where kind of that manageable level of infection is. We've seen that in other prairie provinces, right? Similar approaches in Saskatchewan and Manitoba, not coincidentally, also provinces that are having fairly high case counts right now, not as high as Alberta. And we've seen through, public opinion surveys and even Alberta Health Services' own research that there is some evidence that, people in Alberta have a lower rate of compliance and kind of more hostility towards these types of measures than elsewhere in the country. So another problem for Jason Kenney is opposition within his own party. So we know that a lot of United Conservative Party supporters do not support the public health measures. And even within Jason Kenney's own caucus, we had 17 UCP MLAs, which is about a quarter of the caucus, sign a letter opposing these public health measures. Some of them, including Medicine Hat MLA Drew Barnes, even since last week, have still been publicly opposing even the new measures, given what we know about case counts and hospitalizations.
I mean, how many times have we washed our hands, put on a mask, seen business people working, bending over backwards to keep their premises clean? Why shouldn't those businesses and spiritual places have the opportunity to let us engage in a fuller life?
I've also read that Jason Kenney has said that Alberta has a compliance problem. So is he blaming what's been happening on people?
Yes. I mean, that's it, basically. He's singled out, a sizable portion of the population, the way he describes it, that is just not following the rules, either because they are, in this category of people that were at the rodeo or at the Whistle Stop Cafe that have kind of a very strong opposition to all of these public health measures. In some cases, they buy into conspiracy theories about the pandemic and about everything that's been happening over the past year. There's probably a larger category of people that are skeptical or ambivalent and are just not bothering, right? These are the people that are piling into bars and patios and having house parties. And that sort of stuff has come up repeatedly throughout the pandemic, where we do have a lot of people that just, maybe don't have strong political motivations, but also are just not bothering to follow the rules.
Mm-hmm. Is that what's driving it, as opposed to spread in workplaces that are open legally?
Yeah, this is a big debate. I mean, the province and the provincial government, repeatedly talks about private social events, household spread, and that seems to be their primary kind of explanation for why, we're having these high infection rates. We have had big workplace outbreaks, and a lot of public health experts have been arguing that that's a bigger problem. I mean, people that take COVID-19 home got it somewhere. And if we're not tackling that source, it's very difficult to control household spread. I mean, Fort McMurray is a really good example. Right now, nearly 1 in 50 people in Fort Mac currently have COVID-19. Those are active cases. That's not cumulative. It really is a Canadian hotspot right now. Mm-hmm. And, the Premier has talked about low vaccination rates and low compliance in Fort McMurray. In terms of the vaccination numbers, one thing to remember about Fort Mac is Alberta is young, Fort Mac is younger. So in the early stages of the vaccination rollout, they just had fewer people that were qualifying, right? When you open it up to 75 plus, 65 plus, there's just a smaller share of the population in Fort Mac that fit that group. But there have also been significant outbreaks on oil sands work camps and, fly in, fly out, transitory workers. And, in the community, there's a debate about how much that's contributing to the spread.
So how much more capacity do Alberta's ICUs have?
So right now there is more than 150 people with COVID-19 in the ICUs. So we're just above the peak of the second wave, which happened kind of the end of December, early January. And like we've talked about, we're expecting those numbers to continue growing over the next couple of weeks. The problem there is that you have people who are in the ICU for other reasons. So last week, the Premier talked about how you've got this group of people with COVID, about 150 people, give or take, depending on the day, another 60 people who don't have COVID, who are there for, surgery recovery or because they've been in a car accident or those sorts of things. Those two numbers combined are above where we usually are. There's usually about 190 ICU beds in Alberta. So we're above that right now. We've heard from the province that, they currently have a capacity for about 240. And then an ability to surge to 425. The issue there is with staffing. There's only a finite number of respiratory therapists, ICU doctors, and ICU nurses, and that would require huge disruptions to the healthcare system. So we're talking about canceling most or all non-essential, non-critical surgeries and medical procedures, bringing in staff from those areas to help with that surge.
And why are ICUs an important metric?
Well, there's two reasons. I mean, the first one is, at the beginning of the pandemic, we were given all these messages about flattening the curve to preserve the capacity of the healthcare system and to not reach that point where you're having doctors choosing between patients, who's going to get care, who's not, who's going to get a ventilator. That is really talking about ICUs, right? That's where the most serious, severe COVID patients go. The second reason is that in Alberta, the provincial government has put a really high priority on using ICU beds and ICU capacity as the metric when it comes to looking at COVID-19 restrictions. Do we open up? Do we shut down again?
So how do you think the Premier's handling of the pandemic so far, and then the latest restrictions that he's introduced after being reluctant for so long, how do you think this is going to affect his political future?
It's difficult to know. I mean, he's already been facing a lot of problems. We've talked about, the dissent within the party, within his own caucus. There have been a few opinion polls in recent weeks and months that have shown very low support for the UCP and, conversely, an increase in support in the opposition New Democrats. And part of that, I think people think, is related to the handling of the pandemic. So on the one hand, you've got UCP supporters that think that the party is going too far. You've got people on the other side that are convinced that the government is not going far enough. I'm not sure if this is enough to satisfy those concerns and really move the poll numbers from where we've seen them.
Coming back to what's happening in the hospitals today, we're talking about this because there is talk about having to ration care. Can you tell me what the government has planned in that sense? And does it seem to you like things will get that dire?
Right now, everyone seems somewhat optimistic that that's not where we're headed. We're not going to hit that, 425 people with COVID in the ICU. If it does, then we would be in that triage scenario that you're talking about. So Alberta Health Services has prepared this document that we kind of knew was in the works and had been floating around for a while. It was finally released earlier this month that gives doctors some guidance on, if they really are at that point where there's no resources available and they have to figure out who gets into the ICU, who gets a ventilator, for example, and who doesn't. And the focus is who has the highest likelihood of surviving over the next year. So there's a huge list of complicated criteria to try to assess what is their chance of living. Initially, it will be people who have an 80% chance of dying over the next year are excluded from ICU care. If things get worse, that will move down to 50%. So basically, if you've got a 50% chance of survival or worse, you're not getting into the ICU. Mm-hmm. Again, the doctors that we've talked to have said that, both from the planning perspective and also just healthcare workers kind of going to the ends of the earth to avoid this because no one wants this situation.
So another thing I was wondering about, Ontario has fewer cases per 100,000 people than Alberta, but its ICUs are closer to hitting their full capacity. How do you make sense of that?
This has been a bit of a mystery. We have seen, similar infection rates in the third wave between Ontario and Alberta per capita. But there are a couple of theories as to what's going on, and I think they make a lot of sense. So the first one is that the second wave in Ontario, in terms of the peak of infections, was a little bit later than Alberta. And what that did was there were more people in hospital kind of in early March when both provinces started to see this surge for the third wave. So the baseline for where they were was a lot higher. Ontario just had less room to grow. So another thing is demographics. Alberta has, the youngest population in the country. And what that means is, people who are over 65 that are in that particularly high risk category for COVID-19 complications, they make up 14% of the population. In Ontario, it's 18%. That's a lot more people. Alberta was quicker at going through some of those high risk groups in the vaccination program. We were able to open up vaccinations to kind of the general public earlier than other provinces. And I think we're seeing some of those effects right now.
Yeah. So in order to avoid that scenario, what do you think needs to happen in Alberta?
I think it's pretty simple. People need to follow the rules. I mean, the problem we've got right now is that there's always a lag. So even if some of these early numbers this week really are the beginning of a downward trend where we're bringing down infections, there's about a couple of weeks lag between when, infections peak and when hospitalizations peak, because it takes time from when someone gets infected to become sick enough to need admission into the hospital and to the ICU. So I think right now people are bracing for, how far will this ICU wave go before it also starts ticking down. But yeah, I mean, that's the message. To avoid that kind of doomsday scenario, we need to stop this surge.
James, thank you so much.
No problem. Thanks a lot.
That's it for today. I'm Tamara Kandaker. Our producers are Madeline White and Kasia Mihailovich. David Crosby edits the show. Angela Pacenza is our executive editor. Thanks so much to James Keller. You can find him on Twitter at @byjameskeller. And just before we let you go, we want to hear from you. Let us know what you want us to cover next, or just say hello. You can email us at thedecibel@globeandmail.com. And don't forget to leave us a review on Apple Podcasts. You can also find me on Twitter at Anima_TK. And most importantly, wherever you listen to podcasts, please give us a follow. Thanks so much for listening, and I'll talk to you tomorrow.